In general, they're pre-diabetic, and most people, by the way, are pre-diabetic, don't know it. 80 to 90% don't know it, and yet they will become diabetic
Yeah.
within 5 years.
They're
So
on
we
the path to get there, but nothing has gone so haywire that they've had to go into the doctor yet.
correct, and they don't even know it. They don't realize it, and again, it's very common. So I'm a big believer people should be getting tested for this stuff because they're running around with some glucose dysregulation. And then bottom line is, yeah, that based on what we did was we had people eat these different carbs. We discovered that different people will spike to different carbs. Some people are potato spikers. Some people are bread spikers. And most people, by the way, are rice spikers. People don't realize that white rice is probably more glycemic for most people than ice cream. That
Wow.
really, yeah, it's a strong spiker.
Yeah.
It's really quite fascinating because Asians turn out to be even more spiky than
Yeah.
non-Asians.
Well, yeah, let's come back to that. But the idea here is, right, you just put a glucose monitor, like a blood testing thing that some people you see wearing around might
Yep.
have on. You guys put this on your patients, on your test subjects here,
Right.
and you're measuring how big the glucose response is, how long it lasts to different foods. So you got a bunch of people, you give them rice, you give them potatoes, you give them bread, this, that, and the other, fruit, and you're measuring how high does that glucose spike, how long does the spike last, how long before it goes back to baseline, those types of things.
You got it. So that's exactly right. So first of all, I recommend everyone try these, and you can now get them over the counter in a drugstore. So they'll measure your glucose every 5 minutes, and you'll be amazed. You'll never eat the same again, and I mean that in a good way, because what will happen is you'll see what foods spike you and which ones don't, and then you just gravitate towards the ones that don't spike you. But if you are going to eat the ones that do spike you, go do a brisk 15-minute walk and
Yeah, yeah.
or make sure you eat your salad or various things before you eat that food. And that we can come back to that too. But there are things you can do to mitigate the spikes.
Yeah.
But back to the spiking itself. Oh, go ahead.
I was going to say, yeah, back to the spiking itself. At a high level, like why do we care about the size of the spike? Why would we maybe recommend to people that you want to avoid things that spike you a lot versus a little? What's the thinking there?
Yeah, in general, there's a correlation between something called time and range. So there's a recommended range to keep your glucose in and your hemoglobin A1C level, which these days is the measure people use for diabetes. So the bottom line is the more you're out of control, if you will, with your glucose, the more you're on your way to becoming diabetic. And it's beyond that too, because you can show these spikes correlate with cardiovascular disease risk. So it's pretty clear. They call these postprandial spikes, post-meal spikes. And so basically, based on that, yeah, you're much more at disease risk. And in general, you want to keep your glucose under control because you're at risk for like everything, cancer, cardiovascular disease, especially, but virtually every condition is worse, cancer, et cetera, if you have glucose dysregulation. So we think knowing this early, catching it while you're normal or pre-diabetic, seeing what's going on, excuse me, and then mitigating these spikes should be able to push off getting diabetes. I'm not going to say it's going to prevent you, but healthier habits should help.
Got it. So in general, when we think about blood glucose, it's like a Goldilocks thing. In general, the body wants it not too high, not too low.